I'll be performing a post-mortem care to a patient. First, our supplies is a body bag, 3 name tags or 3 patient labels, a fitted and flat sheet, a hospital gown, and supplies for a bed bath. First, we need to do is if there is a sign that you're supposed to place outside of the door in the hallway, make sure you do that first. Then you close the door and pull the curtain. Prepare the water for the bed bath. Raise the bed up and flatten it out. Remove all the sheets, blankets, and the gown from the patient. Remove any drains and tubes from them such as IVs and Foley catheters, and also heart monitors. Dentures and glasses should go in a container and placed to the side. They should later be placed inside the bag with the patient. Keep the bed bath like you would if the patient was still alive. Some facilities require you to put a fresh hospital gown on them, while others want them to be placed in the bag naked. You should now tie one of the name tags onto the patient's big toe. You will have to unfold the body bag and unzip it all on the way. Then roll up half of the bag long ways. One of you should then turn the patient on their side. The other caregiver should then tuck the old linens underneath the patient and place the clean fitted sheets on the mattress. Tuck the fitted sheet under the patient as far as possible. Now tuck the rolled end of the bag underneath the patient. Make sure the bag is placed in such a way so the patient will be able to fit. Then turn the patient onto their other side and finish putting on the fitted sheet and unroll the rest of the bag. You should then be able to zip up the bag. Don't forget to tie the 2 zippers together with another name tag. Stretch the flat sheet over the bed, completely covering the body bag. Out of respect, you do not want visitors in the hallways to clearly see the person in a bag while they are taken to the morgue.
A warm compress is an easy way to increase blood flow to sore areas of your body. This increased blood flow can reduce pain and speed up the healing process. For this assessment, we need to verify the patient's identity using 3 identifiers. We also need to verify the doctor's order for type of noise, heat application, location, duration, and desired temperature. We review the patient's chart for medical history, and then we assess the patient's skin around the area to be treated and the client's temperature and pain sensitivity. While putting a glove in, explain the procedure to the patient clearly and completely with the patient's approval. Describe the sensation patient would feel and precautions to prevent burning, and also provide privacy at all times. Position the patient in a bed, keep affected body part in proper alignment. Expose body parts to be treated, drape patient as needed. Perform hand hygiene and apply clean gloves. Place a towel or absorbent pad under the area that you will treat. For this procedure, we will put a hot compress on the ear of the patient. We apply heat compress to the affected area, which is the ear molded over the side. Check the area of application every 5 minutes for tissue tolerance. Stop application immediately if any untoward incident or problem occur. After the prescribed time for the treatment, up to 30 minutes, remove the warm compress. Inspect the body part of the wound condition for evidence of the effectiveness of therapy and sensitivity to touch. Ask the patient to describe the level of comfort and burning sensation following the treatment. After that, we need to identify any unexpected outcome. And also, we need to remove our gloves and use a proper sanitization in order to maintain the cleanliness. Document and report all the pertinent information of the procedure performed. A cold compress is used to cool an injured area to reduce pain, swelling, and inflammation. It works by constricting blood vessels, which can help slow bleeding and minimize bruising. The benefit we could get from a cold compress is reducing the bleeding, reducing the hematoma formation, and even reduces blood flow. For the implementation of this procedure, we need to verify the patient's identity using 3 identifiers. Verify the doctor's order for type of moist cold application, location, and duration, and desired temperature. We review the patient's chart for medical history. We assess the patient's skin around the area. And also, we assess the patient's and family's awareness. As we assess the patient, we need to identify the expected outcomes and also assemble and prepare equipment and supplies needed. As we are doing our proper gloving, we need to explain the procedure to the patient clearly and completely with the patient's approval. Describe the sensations patient would feel and precautions to prevent the friction and numbness. We also need to provide privacy at all times. We position the patient in the bed, keep affected body part in proper alignment, expose body part to be treated, drape patient as needed. For this scenario, we are treating a dental pain. We perform the hand hygiene and apply clean gloves. We place a waterproof pad or towel under the patient's body part if appropriate. We submerge washcloth or small water into the water and wring it out excess moisture. After we apply cold compress to the affected area molded over the site, we need to check the skin condition every 5 minutes. We remove gloves, dispose it properly, and then use a hand sanitization to maintain cleanliness and then document.